Hey, wow. Whew, a lot of not great things happening. So I went and had my CT scan, which was done in my abdomen. And then I got those results, and they said, "Hey, turns out the 4 rounds of chemotherapy that you didn't do anything to your cancer in your pancreas." They were hoping to shrink it and then say, "Hey, we'll do more, and then we'll operate on it and cut it out." Because right now they can't cut it out; it's unresectable because it's around the artery. Uh, so I thought, I was going in. I'm thinking, hey, the results are either good, or they're going to start me on some other kind of a round of medication or whatever. Try something new. Fat chance. Let me tell you one thing about pancreatic cancer, any kind of illness. It can always get worse. Is everybody listening? It can always get worse, really. So if you pray, if you paint mandalas, if you dance in the woods, whatever you do to connect to the spiritual universe, do it. And just give thanks for your lucky stars for whatever you got, however small, however big, however little, however large, because it can always get worse. Case in point, the chemotherapy did not work, and then they said, "Hey, but we did also find a little dot on your spine. And it's disconcerting, and we're worried because this could lead something to like you not being able to walk." Mind you, a lot of my pain comes from my spine area. If all my pain medication wears off, it feels like I've been cut in half, literally, just right there at T12, which is where this dot is. So they're like, "Hey, you got to go get an MRI stat." And they're like, "Well, it's not urgent, but we want you to get one by tomorrow." So they set that up. I go get the CT scan. They do my entire spine. You got to sit in that tube for an hour and a half to do the whole spine. Now, on the plus side, last time I did a CT scan, I was way overweight, and they stuffed me into the largest CT scanner they had. My arms was all crushed up like this, and it was weird, and my arms fell asleep, and it was terrible. Thank God that was only for just my abdomen, so it was much shorter. It was like 30 minutes in the tube, but this was an hour and a half. But because I lost so much weight, there was so much room. This wasn't even the largest MRI machine they had. It was one of the smaller ones, but I had enough room. I thought, God, I could bring in a chair and a table and hang out here. So they're like, it's going to be an hour and a half in the tube. I went in there. I fell asleep. No kidding. Anyway, that was a shining light in the day. But they did the MRI, and they're like, "Yep, it's what we thought it was." They call me the next day, and they say, "Hey, we want you to come in again I was going to go in the following day, but they said, don't come to that appointment. We want you to come to this other appointment where they'll have my oncologist, my nurse practitioner, I guess my nurse, and also some other doctors. I guess a radiologist or whoever manages radiation therapy. And I don't know, because this appointment is tomorrow, actually. So yesterday is when I got the call about the results of the MRI. And in addition, in those results, it's like, "Hey, so yeah, we're pretty sure that is cancer there, and it's worrisome, and we want you to come in on Thursday." This was on Tuesday. "But we also want you to go to the dentist because we're thinking of doing this therapy that causes some kind of bone necrosis, specifically in your jaw. So they're like, we need you to go to your dentist and get a little update on your dental health, periodontal health." So I'm like, yeah, okay. So amazingly enough, I go to my dentist and I'm like, hey, I got this thing. I need this. And they're like, we'll get you in tomorrow. So this morning I went and they did the full dental checkup. I've always tried to take good care of my teeth. And let me tell you, flossing is the best thing you can do, flossing and brushing. If you don't ever brush, the least you can do is floss, because I think in some ways flossing is like the number one thing to do. I do that religiously. I just kind of do it and it feels good. And also, I also have a water pick, but it's this kind that's called a shower pick, or it's like, yeah, shower floss, and it connects to your shower. So it's kind of like the poor man's water pick, and then it doesn't, I mean, it costs like $10 on Amazon. It's the most amazing water pick you'd ever have. So don't even bothering of buying one of those fancy water picks. Get one of these shower picks and connect it to your shower. It's so badass. It works so beautifully. So I do that. And then I also do the thread kind of flossing, and that's paid off because I hadn't been to the dentist in like 5 years. And they're like, oh, your teeth are all good. You know, we have this one cavity that the filling is cracked and we're going to fix that. But other than that, you're good. So that's a bonus, because apparently I need to have really good periodontal health in order for them to do this therapy. So back to the subject at hand. I'm going to go in tomorrow. They're going to talk about what the next steps are for this discovery. And she told me about radiation. So we're probably going to do some targeted radiation, is what I'm guessing, that they're going to try to burn that spot off my spine. Apparently, to the best of my knowledge, and I don't know, maybe they'll tell me more when I get in, but I think this one spot is the only place where my cancer has shown up as far as spreading. So I have it in my pancreas, and now this spot on my spine is the metastasis of that cancer. So hopefully that's the only spot. And in the course of these meetings, sometimes you're on the phone and you're just taking in this information. I have to say, it's so surreal because it's such heavy information, and you're just like, okay, and you're trying to make mental notes, and unless you have a pad in front of you and you're taking notes, even then when you're doing that, it's just like, it's so heavy. It's just like you're trying to remember stuff and you're also trying not to freak out. So in my last video, I talked about worrying, and I try not to worry. I have to say, this has got me a little bit worried. At the same time, I'm just kind of like, I'm resigned to it. You know, it's like just trying to make peace with this feeling, with this news, because that's the only thing I can do. So we'll see what's up tomorrow. I mean, I guess one of the big worries is if they can't make this cancer shrink, then, you know, it could affect. It's at T12, which means that I could lose function of my bowel and my bladder, and more importantly, I could lose function of my legs. And I already had kind of an incident when I was at the beach with my niece. We were taking photos, and I was kind of on a slope, and I kind of squatted down and I backed up, and I kind of lost power in my legs, and I like moved back, and it happened twice, and I was like, oh, that's weird. And I thought, well, I've lost all this weight, and one of the things when I was losing all this weight is, man, I lost all this muscle that I had in my legs. I mean, my legs used to be really strong. I did martial arts, and I used to do this thing called the horse stance, where we did all these exercises in the horse stance. Try it sometimes. It's one way to build the largest muscle in your body, those thigh muscles, but it's hard. It hurts. I mean, and I had really big, strong thighs and calves, and they've just kind of withered down to little sticks. And I thought maybe it's from that. But now I'm thinking about it, and I'm thinking, well, maybe it was from that dot on my spine, just me moving in the right way and it pushing on it. The other thing is my pain level has increased. I really thought we had this under control, but no, it's like gone higher. And now, like today, I was just in pain all day long. And when I lay down, it gets worse. and yet you're tired and you got to lay down. And so it's this vicious cycle that kind of keeps going around and around, where you're in pain and you got to take the medication, and that takes it away for a little bit, and you're tired and you lay down. But then while you're laying down, it affects the pain more. So you have more pain, which means you need more medication. And I've always been really careful about taking too much medication, because I don't want to become all dopey and just not able to function in life. But so yeah, so that's the other thing I have to talk about with my doctor tomorrow, is that they got to adjust my pain medication, because it's not working, man. It's just not working. The other thing is that I had a lot of, I have like 8 herniated discs, which is kind of unheard of in some people. Some people would look at it, doctors would look at it and say, how is it that you're walking around? But I did martial arts and motocross, motorcycle racing, and just a lot of crazy stuff. And I got banged up. I was in 7 car accidents too. And I also had accidents lifting, a lifting accident, which was my first major injury to my lumbar disc. I have 2 injured lumbar, 3 thoracic, and 3 in my neck. And I had an operation in my neck, which was scary as well. But I've made it this far, and I can still walk and everything. So I was kind of really proud of that. And somehow I thought I was going to survive that way. That was my big worry, like, hey, just take care of your back, But this cancer is a new kind of back pain, and it certainly takes precedent over everything else, because it's such a freaking killer, and no pun intended. But yeah, so the thing is that I had all these MRIs previous to this MRI. And so I had one as early as last April. I'm sorry, was it? Yeah, April. So I had one that's just about a year ago, less than a year ago. So they said this spot, it didn't show up on that other one, but it showed up on this MRI. So that means it is a brand new cancer that's showing up. So they can kind of say for sure that, of course, I had it first in my pancreas, and now it's metastasized to my bones, specifically in my spine, hopefully in this one area. So that's what I'm looking at in this meeting tomorrow. So I guess the concern is there. I have bone cancer also. Now I can add that to it. And then I also have, it's been, my pancreatic cancer is metastasized, which is the big worry, right? And also my CT scans resulted in negative results for the chemotherapy, but also in the discovery of this cancer in my spine. So it's a lot to take in. Tomorrow's going to be a big appointment, and I hope to find out some positive news, maybe. I guess real positive news will be not what you're going to do, but can you do something that's successful? And hopefully we will get there with that. I'm just at 3 months from my diagnosis. So I've lived 3 months with this pancreatic cancer. So now I'm working on another month. We'll see how that goes. But yeah, that's where I'm going. Anyway, that's the update. It's not a happy update. I don't think I'm really sharing anything that's helpful to anybody. This is kind of just an all about me video. Other than my first piece of advice, which is remember it can always get worse. So keep your hopes up, keep praying, whatever it is that you do to make yourself feel better, or to ask the universe or God for help, other people. That's one thing that has been really good, is that I know a lot of really beautiful people, and people that I know well in my life, but who are not like friends that you call every day and you BS with, but people who are professionals in my life. For instance, the woman who is the dental tech at my dentist, and who I hadn't seen her in 5 years. And when I went in there, she was like, "Hey, I didn't recognize you because you lost so much weight." And she's like, "Tell me what's up." Last time I saw her, she was pregnant, and then I see on the wall there pictures of her little girl, who's just like a little doll, so beautiful. And we're talking, and I tell her everything, and she's totally understanding, and she knows, what I'm talking about, because I'm there for that specific test because of the effect it can have on my jawbone. And then she's like, I'm going to pray for you every day. And I have people like her who, I consider her a friend. She's somebody who's cleaned my teeth for, oh my God, I've been a patient there for almost 20 years. And she has been cleaning my teeth for that long, and she's awesome. And, wow, it's amazing how people around you, that, they occupy bigger places in your life than you think they do. And they might care about you more than you think they do. Maybe you care more about them than you realize as well. But that whole praying for you and thinking about you and everything, like, I think that works, even if you don't get some kind of miracle magic result, like, oh, my cancer disappeared. At least you have that connection with people, and it's a beautiful thing. And I think you benefit from that one way or the other. So don't forget about that. The other thing is always stay hopeful and try not to worry. I'm trying not to worry. I just want to make peace with it. But again, things can always get worse. So be grateful for whatever you have. Even when it gets worse, be grateful then and there that it's not worse than it could be. So be grateful, my friends. Be grateful.